Hi, I'm Pamela Madsen, and welcome to another segment of Journey to the Crib. And I'm here with Dr. Dave Kreiner, who is the founder of East Coast Fertility. Thanks for joining us. When we were talking together last time, Dave, you were talking about the advances in the field. And I was curious about how those advances have changed the way you practice medicine today at East Coast Fertility, because you were talking about the fact that it's much more successful today.
Yes, back in 1985 when I first started in IVF, we had to transfer 6 embryos at a time in order to get a 15% pregnancy rate, and that was the best in the world. Unfortunately, patients would often try 1, 2, 3, 4 times before they would be successful in achieving a pregnancy, and when they did, they sometimes had multiples, even triplets and quadruplets. So that we can today be much more successful with even 1 embryo is tremendous, and avoid the risks of multiple pregnancy.
I'm really impressed with the single embryo transfer program that you've very quietly been doing here at East Coast Fertility for several years now. Can you tell me a little bit more about that?
We have patients go through a single IVF cycle. They pay for just the 1 cycle, and then everything after that is free. The embryo freezing is free, the storage of the embryos is free, and they can come back an unlimited number of times to have these frozen embryo transfers until they're successful with a pregnancy and have a baby.
To me, this is just so extraordinary because, I can't tell you how many conferences I attend with, all the world-class doctors like yourself getting up and speaking and pontificating, actually, about how important it is to have single embryo transfers. But they don't do anything to help the patient actually do single embryo transfer. Because for the patient who's paying out of pocket, they have to pay that 1 fee. Why would they want to transfer 1 embryo, and what are they going to do with all those other embryos? Then they have to pay for freezing, they have to pay for storage, and they have those fears around, if it doesn't work this one time, how am I going to pay for it next? And the single embryo transfer, the program that you've developed, really takes that burden away from patients. And I think it's incredibly unique and important. So, bravo.